almost everybody has had the experience of stress-related symptoms at one time or another. Anybody who's ever blushed with embarrassment, anybody who's ever felt a knot in their abdomen when they're in a tense situation, that's what we call a psychophysiologic reaction, a mind-to-body reaction that produces real physical symptoms. They're not imaginary, they're not quote-unquote in your head, they're real. And if the level of stress is high enough or goes on for a long enough period of time, that can turn into what, for all intents and purposes, is an illness. It can cause back pain, it can cause ringing in the ears, it can cause any kind of gastrointestinal symptom, any pain in almost any location in the body, typically multiple symptoms in many people, more than one location at a time, but they're all real. And they afflict 1 in 6 adults and 1 in 3 of everybody who goes to see their doctor for an evaluation. So these are very, very common, can be very, very severe. Many of my patients have been hospitalized for this. It reached that level. It can go on for decades. My personal record patient was ill for 79 years. My personal record patient for hospitalization was 11 straight weeks, and when I was asked to see her, it was near the end of that time, and she was getting enormous doses of morphine around the clock for her symptoms. So the severity can absolutely equal what you find from organ disease and structural abnormalities, and the number of symptoms typically exceeds what you get from organ disease or structural abnormalities. My personal record patient there came to me with a printout from the internet on which he had circled 27 different symptoms that he personally was suffering from. And yet all 27 were relieved in about a month in his case. So in spite of the severity, the outcomes, if you know what to look for, can be very, very good with this form of illness. Yeah, absolutely. Many of my patients have been ill for more than 10 years. The very first patient in my book had severe attacks that put her in the hospital 4 times a year for 15 years. And yet, in her case, and this is a little unusual, but she was cured in a 1-hour conversation. So just by, in her case, getting the insight about where those symptoms were coming from, seeing the connection to a particular severe stress in her life, bringing that into conscious awareness. In her case, that was all that was necessary. She called me up a year later to say that she'd gone an entire year with no symptoms, and she'd previously had 6 or 10 severe attacks in a 12-month period of time. So yeah, absolutely, those can improve. And there is a very wide range of speed with which people recover. The patient that I mentioned earlier who was essentially well in an hour, and on the other end of the spectrum, I found out about one of my patients who went off to therapy with some very good ideas about what to work on, but even after 20 years of mostly going to therapy on a regular basis, she still had symptoms. She wasn't taking narcotics anymore, she wasn't being hospitalized anymore, but she was still having symptoms. So there is a wide spectrum, and your question is what accounts for that? And it has to do with the severity of the stress that they were subject to, what age the stresses occurred. We're more vulnerable when we're very young. Was there any offsetting support that the person received when they were experiencing the stress, particularly as a child? Their own resilience qualities, and there are a number of elements that go into that, but people differ with respect to how resilient they are in coping with stress. People's ability to be in touch with their emotional reaction. Much of stress-related illness is linked to repressed emotions, and how easy is it for you then to get into contact with those emotions, to recognize that those emotions are there, to bring them into conscious awareness. That's a skill that differs a lot from person to person. But even the people who are going to take a very long time to make a full recovery, they can tell that they're on the pathway. They can tell that they are moving in the right direction often it's been a long road for them just to find out what they need to do to get better. But once they do find that out, once they do recognize that they're on the correct pathway, the anxiety, the fear that people are losing their minds about this symptom, that tends to go away, and they can see that there's a way to move forward. And that makes a huge difference. It's an important question about, and there's controversy about this in the field. Do people need to fully embrace the idea that they have a mind-body condition or a stress-related illness in order to make any progress at all? And my own take on this is that it's not necessary to draw a firm conclusion about that. It's perfectly okay to wonder if you've got a possibility of an organ disease or a structural abnormality, and if you're worried about that, continue to work with your medical clinicians to exclude those possibilities whenever they come up. But at the same time, the more tests that you've had done, the less likely it is that there's an organ disease and a structural abnormality, and that makes the stress connection more likely. And so you shouldn't ignore that. You should work on those issues, try to uncover the underlying stresses, try to reduce the ones that you uncover, and see if you get better. If you find that your symptoms are making progress, that's going to give you increasing confidence that the stress connection pathway is the one to pursue. But anytime you have a flare-up, and it's perfectly normal in recovering from this illness for there to be ups and downs in your symptoms, for the symptoms to move to different places in the body or to mutate into something else, like insomnia, for example. And if you have worries when that happens, by all means go back to your medical clinician and get it evaluated. But in the meantime, don't neglect working on the stress. Don't neglect working on the issues that you've uncovered to keep moving forward. 2 steps forward, 1 step back is a very common pathway for people who are recovering. The second thing that I would do to help you with this concern is to look at the list of questions that we've placed on the PPD Association.org website. At the moment, there's about 30 of them. We might increase that in the future. But these are questions that help establish whether your illness is occurring in the context that we find for many patients with psychophysiologic disorders or mind-body disorders. It asks you about a whole lot of different aspects of your symptoms and of your life to see, are you fitting into this pattern? Are you sharing characteristics with other people who have been down this road? And the more of those questions to which you answer yes or in the affirmative, the more likely it is that your underlying symptoms are linked to stress. A patient who has found their way to understanding mind-body or stress-related illness and who is working on the issues and is not making good progress, and that's certainly not an unusual phenomenon, and oftentimes means that they simply haven't found the underlying stresses or connected with the repressed emotions to the degree that is needed. And that's a struggle. Many patients with this form of illness were placed under stress or adversity at a very early age in their life, and they got very skilled at repressing those emotions. And oftentimes the adversity was inflicted on them by people that they still care about, which is still another reason why those emotions may be kept in the background, or that they want to have reestablish a positive relationship with, and to have those emotions come into conscious awareness might interfere with any hope for reconciliation with that person. So a lot of good reasons to keep the emotions that are causing these problems in the background, and connecting with them is difficult. So Recommendations there, if you can work with a therapist who's got experience with this. Many mental health professionals are not so experienced with the kinds of issues that occur in people who are physically ill. But if you can find one who's got that experience, that can help. The smartphone computer application called Curable will often help people connect with these. There are numerous good books to read on this subject, and they're all different. So if you've read one or two of them, reading a third or a fourth might give you insight that you haven't had up to now. So these are some of the techniques that might help you break through to an understanding of the underlying causes. One of the best places to find a practitioner is in the directory on the ppdassociation.org website. We are listing the contact information for people that we feel have experience and interest in this area enough to help patients with their issues. So that's the first place I would go.